Hospitals are hiking charges, jacking things up, in some cases marking things up 1,800%. National Nurses United is on the case. Check it out, leave your comments, ding the bell, share it with your friends, and subscribe to our channel. We were talking in the first hour, or the second hour of the program, about freedom and what freedom means, and one of the aspects of it that I talked about is you're not free if you're sick, particularly if you can't afford to pay for your own health care. Nobody has been more on the front lines of this than National Nurses United, nationalnursesunited.org, the largest nurses union in the country and one of the biggest advocates for a national single-payer health care system. Marissa Lee, a registered nurse with National Nurses United, she's the nurse leader, is with us. National Nurses, by the way, is the Twitter handle, is on the line with us. Marissa, I understand there's this new study that shows that hospitals, in many cases, most of these giant corporate hospitals, in fact, 53 of the top 100 in the country are owned by that one company that Rick Scott used to run, that he committed the largest Medicare fraud in the history of the United States, and then took that money and became governor of Florida and now senator from Florida. That these hospitals, in retail, if you go into a store and you buy, a piece of clothing that costs $12, Keystone is the normal markup in retail. It's called Keystone, which means that if you buy a $20 shirt, it costs the store $10. In other words, they double the price at retail. But 18 times? Is that what I'm seeing here?
Yeah, that's exactly what you're seeing here. First of all, thank you for giving me this opportunity to talk to you, but 18 times. So if you have an item that is $100, the hospital is charging $1,800 for that item.
That is mind-boggling.
Yes, it is. Yes, it is. And as a nurse, I see the consequences of people not getting health care or being afraid to go to the hospital because of the cost. So now we see patients that are sicker. Okay, I'm a labor and delivery nurse. I've been a labor and delivery nurse for 36 years, and you would think that it's, for mothers having babies, it would be easy. I have a patient, my favorite patient, and she comes in every week. She's full-time employed, but can't afford the deductibles of her insurance, cannot afford to go seek prenatal care, so she seeks prenatal care at the hospital. What is that saying? That this country is falling apart medically. And what I mean by that is that the cost of getting care has increased almost 411%. So most of us can't afford to get any kind of health care, any kind. And if you do, it's the minimum. And then your co-pays and your premiums are going to be astronomical. Okay.
Yeah, it really truly is nuts. And Marissa, what is? I grew up in Michigan, and the first two businesses that I started were in Michigan, and this was back in the 70s. And we had a little business with 18 employees. We provided health care to all of our employees. I remember it very well because I wrote the checks. And it cost me $35 per month per employee, and that was for a full family policy. But in Michigan at that time, this was in Lansing, Michigan, the three hospitals in Lansing. St. Lawrence was run by the Catholic Church. Sparrow was run by a nonprofit foundation that was endowed by a guy named Sparrow back in the R.E. Olds days, back in the 20s. And then the third one was Ingham County. It was run by the county. All three hospitals were nonprofit hospitals. The law in Michigan required that the insurance that I was providing my employees, which was Blue Cross Blue Shield, was provided by a nonprofit corporation that was state-based. It was Blue Cross Blue Shield of Michigan, and it was nonprofit. And expenses were not that great. Our oldest kid was born 45 years ago at St. Mary's Hospital in Livonia. At that time, I was working as an engineer at RCA. And in fact, it's a long story, but I don't recall, and I wasn't making a lot of money. I mean, I was kind of on the bottom of the food chain in the engineering world. And I don't recall paying a penny in terms of copays or anything, and that was in a fancy hospital. But again, it was a nonprofit hospital. It was run by the Catholic Church. What has changed? How did this change? And how do we get it back? How do we get back to some sense of normalcy?
Okay, what has changed? Hospitals have become a corporation for profit. It's not any longer about the patient. It's about making profits. For example, the corporation that I work for is the biggest offender. And I work for HCA, the biggest offender of market gouging, increasing prices, and yet they're as a nurse, as a frontline nurse, I don't have the equipment to take care of those patients. And I don't have the equipment to protect myself. What do we need to do? We need to have a universal care system like Medicare for All. And people are saying that Medicare for All is a socialist, but it's not a socialist. We're taking care of our patients, we're taking care of our people, and nobody's left behind. People nowadays fall to the crack. And when they come into this hospital, to my hospital, they are really, really sick. Medicare for All will provide preventive care so patients don't wait till they're in extreme. They're not deathly ill. We need to focus on what our society needs. It's not being provided. ACA was the leading step, but we need to take it a little further, and that's where Medicare for All comes into play. It takes it a little farther, looks at the individual, doesn't forget that individual that fell to the crack, doesn't forget that pregnant woman that can't get any health insurance because her co-pays are so high, and she's fully employed. Doesn't forget that individual.
Yeah, we're talking with Marissa Lee, RN, the nurse leader at National Nurses United, and nationalnursesunited.org is the website, the Twitter handle at National Nurses, one of the premier nursing organizations in the country and one of the leading advocates in this nation for single-payer health care, and has been for a long time. I've for a long time had so much admiration for y'all. Marissa, we have about a minute and a half till we're going to hit our break here. What sort of changes are you seeing on the horizon now that a new administration is going to be coming in? Are you and the folks in your union getting the sense that Medicare for All or something close to that might be a possibility?
I see that. I see that because it's not about the previous administration was about that one top percent. This administration is looking at the total, not forgetting that lower middle class or lower class, or those that can't afford. Whereas the previous administration, it was about the profit, those that were at the top 1%. And everybody else was irrelevant. Everybody else was, they're fine. They'll do fine. They're fine. Just like, he said this pandemic was a hoax. I've seen the effects of the pandemic, so,
Have you had, Marissa, in Utah, one of the hospitals there is reporting that they're getting these COVID truthers, people trying to sneak into the hospital with cameras thinking that they're going to find that the ICU is actually empty and there's no COVID patients there. Have you seen anything like that in where you're practicing?
Okay, I'm in Florida. Not to this moment, but I will gladly show them the COVID unit. I will gladly welcome them in and show them how an abundance and the shifting of patients. And the shifting of patients that are still COVID positive, but we need the bed for a sicker patient. So I will welcome them. I will definitely welcome them.